Folks, we've just had the best news ever about COVID-19 and the media is ignoring it because, hysteria sells, but not here. Because this is the beautiful truth.
You are on the next level. This is the beautiful truth, where the expression is still free.
10, 9, ignition sequence start. 6, 5.
And you are very welcome. This is The Beautiful Truth on breakfornews.com with Fintan Dunne reporting at 11 a.m. Eastern on the 19th of April. Folks, we've had terrific news out of the tests done in Santa Clara County, which mean that you may be able to go back to work and this virus is not the threat we all thought it was. I'll bring you up some of the news as it's been reported around the media. This one here on California study shows 50 times more people than projected have had the coronavirus and are now immune. And there is that test taking place recently. It was back at the beginning of April where people in Santa Clara County were tested for this virus. And they tested 3,500 almost of them just to see who had antibodies to the virus. And the results were amazing. They've been reported, but nobody's working through the stats. I've done it, and it means this is great news. So a lot of the negative coverage has been about the fact that 3.5% of the people in the county have got these antibodies, and that therefore 97% of people in the county don't have antibodies, and so we're all still seriously at risk, according to the hysteria mongers. Is that the case, though? Let's just do some very simple work on the data that came out of that. I have the abstract here, and I've gone through this report. I've gone through the scientific report, and I've just done some very basic calculations on it. And this is terrific news. So there's 2 million people in Santa Clara County. That's why I've got a figure there, 2 million. And they say that around about 70,000 people, they calculate, have got antibodies based on the 3,000 they surveyed, right? They have around about 1,000 cases at the moment identified. And now they've found out that 70,000 people may have the antibodies, and yet only 1,000 of them have shown up in hospital. It's a no-brainer that way. If 70,000 people right now have antibodies, it's only 1,000 people that shown up in hospital at the time the test was done. Therefore, you knew automatically 69,000 people have had this and they haven't had a problem. They've had no problem. They felt fine. Well, some of them may have had minor symptoms, but there you go. They didn't come to medical attention. They didn't feel they needed medical care. So that's our figure. So now let's just do a few simple calculations. I'm not going to nerd you out on this. This is easy. You've been listening to all the hysteria. You've been listening to the WHO, the World Health Organization, the bunch of criminals organization, tell you that 3.5% was the mortality rate. That's what they came out with and said. So here's their figures here now. The real ones. 1,000, right, is the number of people who had shown up seeking medical care out of the 70,000. Now we know the size of this invisible iceberg below the surface. We now have the size of it. They thought it was 10 to 20 times now, but it turns out to be 50 to 80 times more people than show up in casualty or in a doctor's surgery. So we can now work out that 1.42% is the percentage of the population who ever need to seek medical treatment when they contract the virus. See, that was easy. Now we finally have that figure, and it's only 1.42% of those who are infected will require medical attention. Let's just take it on a little bit further then, beyond that. If that's the case, 1.42%, then suppose that 1.36% of those who came to medical attention died. Then our actual infection fatality rate will be 0.019, or approximately 1/5 of 1%. 1/5 of 0.1%. So let's take another figure then. Let's assume a drastic mortality rate. Let's assume a 3% mortality rate on the 1.42% of people who do come to medical attention. And now we can see what the actual final case fatality rate would be. The infection fatality rate would be half of 1/10 of a percent, 1/20th of a percent. at that rate, 1/20th of 1%, assuming a 3% fatality of those who do come to medical attention, which is justified. It varies between 1.5 to up to 6, depending on jurisdiction and the treatment services available, and all sorts of other factors, and age. Wow, that's a lot lower than 3.4% mortality, isn't it? 1/20th of 1%. So suppose we then got this figure, 2 million people, which we have in Santa Clara County, and we say, okay, well, at 0.0426% of those 2 million people, there's our final figure then of the people who we'd expect to die, 852. But even that's an exaggeration, would you believe? It's an exaggeration because all of these figures are theoretical, scientific, absolute figures done by medical practitioners and not a real world projection. They're just used for comparative basis, in their own work. In the real world, it's different. See, in the real world, let's just take it from The Guardian here now, which is downplaying this report already. In the real world, The Guardian answers the question, how do we move forward based on this new findings? Well, with a disease like this, says the article, you probably need something in the order of 60% of people to have immunity in order to prevent an epidemic. And we've only got, 3.5% or whatever. So we're nowhere near that. But hold on a second. You just admitted there that you need 60% of people to have immunity to prevent an epidemic. So what you're admitting there is that when 60% of people have immunity, an epidemic will stop. And if an epidemic stops when 60% of the people have immunity, then is there really a risk to the whole population? Are your figures actually wide out? I think they are. I think we can come back and take a look at this figure again and do some more work on it, because it'll never get to the whole 852. It'll only get to about 500 of the 852, even based on their own stats, because it'll fizzle out and run out of steam. Maybe it'll go higher, 600, 700. See, the problem is that there's some people who just never get infected. They're just not around other people enough. And there's some people who have really strong, good immunity. And not only that, they have innate functions, which mean that they just didn't ever even manufacture antibodies to it. They may have had some minor exposure to it, but it never even reached the level of antibodies. So in fact, the true risk is far, far, far lower than has been presented so far. And let me give you the true risk. And I'm just going to use the figures we've just been working with there. So what we can say now is that we now understand that for every 100 people who contract this infection, right, 6,900 people will have no problem. Wow, that's good news, isn't it? That's terrific. So of every 100 people who come to medical attention, there's another 6,900 people out there who've been exposed to this and they never even needed a doctor. And of the 100 people who do come to medical attention, we now know that around about 3 of those will die. Of the 3 who die, 1 of those would have died before the end of the year anyway. Another 1 of the 3 who died is probably over the age of 65 and has 1 or more medical conditions. And 1 of the 3 who die are younger than that and are a true tragedy. Not that any death is not tragic, but where someone has life before them. 1 out of the 3 are individuals with life before them. And there's another 6,997,000 people going around having no problem at all. Maybe some of those 6,997 people could go back to work. Maybe if we scaled up those figures, 697,000 people could go to work, or 6,970,000 people could go back to work, or 60 million could go back to work. Because the actual exposure of the virus threat to them, being young, being in good health, and now knowing what we know about 1/20th of 1% being your actual risk here, they can safely go back. And they will act indeed as a buffer to protect the old and vulnerable, where now we're seeing that really all along, we should have protected the nursing homes. We should have focused on the most at risk and not just cast a blanket wide net like this, where actually all we're doing is destroying our own economies needlessly The Swedes had it right all along. The vast majority of people can go back to work, and not only that, it is now the smart move to do it that way. Because now that we know the absolute risk to individuals and the effective risk is so low, there is no risk, relatively, to us all getting back to work as soon as possible and starting to put this behind us. We have been hyped out of it by these figures, and even as I speak, what I'm saying to you is not being bluntly stated in media. It's not being stated at all. The implications of this study have not been followed through on, and it's not the only one. Other studies have confirmed this. Right, that is the beautiful truth on coronavirus. I'll be back with more soon. I hope you can join me for that. But in the meantime, this has been Fintan Dunne reporting.